to you. I'm Teresa Dufour with today's CT Style Express. The pandemic affected everyone differently, and that includes children as well. Here from Community Health Center is Chief Behavioral Health Officer, Dr. Timothy Kearney. Nice to see you, Doctor. Thanks for joining us via Zoom.
Thank you for having me. It's very nice to be with you.
So I think this is an important topic because sometimes adults worry about themselves and getting back to work, but the kids are so affected by this pandemic. What are you seeing as a whole?
Well, thank you for that question. That's a great question. We are a statewide organization, so I can speak for myself. I can speak for what my 200 or so staff that are working with kids and adults around the state tell me. And what we're seeing is a wide range of responses.
Okay.
When the kids first went out, it was, of course, a lot of unknown. Who knew what was going to happen? A lot of disruption in the day-to-day life. Now, most kids are back in school, many of them full-time. And for most kids, that's been a good experience. Most kids are talking about what they really missed was their friends.
Sure.
And they're back and seeing their friends again, so they're happy about that. Although I do have a handful of kids in treatment that getting back has been more difficult than being home was. So there's not 100% answer one way or the other. I'd say most kids are doing better with that. Very often we're hearing a lot of fear still, a lot of anxiety. And then there are just some responses of things like difficulty concentrating, boredom, irritability that we're seeing across the board, across all ages. But I think that the best thing for kids right now is that there has been a resumption of a regular routine, a predictability in their life. And yet, of course, so much is still in question and up in the air.
Yeah, absolutely. And Doctor, let's talk a little bit about the vaccine. We know that 12-year-olds later this month are going to be approved for it, but there's still a lot of hesitancy. What would you say to parents who don't have the right answer yet?
Well, I'll tell you exactly what I do say to them, because this comes up on a regular basis in my work with families. And I say, we got two hands here. We got on the one hand, the reality that nobody is safe until everybody's safe. Mm-hmm. And the more people we get vaccinated, the less chance there are that we're going to be spreading the illness. It helps our own safety, of course, and that's important, but also helps the safety of those around us. So that's an important factor. On the other hand, there's just a lot of unknowns, and I certainly got the vaccine myself, but I had to weigh that as an unknown for me. And yet, when we're thinking as parents, what do we want to put in our kids' bodies? What's wise, what isn't wise? I'd say the best thing to do is keep up to date with the information that's coming out. As more information is coming out, talk to your primary care provider. They know your children, they know you, and they know what works for you and your family. And then make your own decision, but have grace for those who make a different decision, because that's been tearing families apart too, where people are going in two different directions and having a hard time reconciling that.
Dr. Tim, what would you say, or how would you prepare a family for that pre-COVID life? I mean, kids have been inside for a year. There must be some preparations we should take to ease into this.
Yeah, I think that's a really good question. And what I'm trying to help families understand is we're not going to have a pre-COVID life again. We're always going to have a post-COVID life. And so we're always going to be aware that maybe things will change and maybe we'll have to pull back again. That's always going to be in people's minds. Mm-hmm. And even resuming normal, regular activities, which everybody wants to get back to, kids want to get back to, we want to get back to as adults. Even that, you're resuming them with different kind of anxiety now. And you're also resuming them with a different reality. It looks like camps are going to be open. I've talked to folks that are setting up camps. I've talked to families that are planning to send their kids to camp, but there's going to be social distancing. There may be masks still for some activities. There may not be for other activities. Mm-hmm. There's just a lot we don't know. So I would talk to children about the importance of having trusted adults that they can ask their questions to, that they can work through their fears and their concerns, because there's still going to be a lot of change.
Right. And are there some telltale signs that parents should look for if their children are having an issue adjusting?
Yeah, that's also a really good question. And parents know their own children. Mm-hmm. So you kind of have to, I'm going to give you some ideas, but you also have to think about it in terms of your own kids and what's true for your kids and what isn't true for your kids. So in a lot of the reports out there, 85% of the parents are saying they've seen some changes in their kids. So there are things like increased anxiety, increased depression, fear in particular, difficulty concentrating. So I think what you want to do as a parent is use your normal skills and techniques that you have talking to your children, encourage them to use their own coping mechanisms, and see if things are getting better. If they're not getting better, then by all means reach out to behavioral health professionals such as myself. Go through your primary care provider, other people in your life that are trusted sources for yourself, and begin to think through what the next steps are.
Very good. Dr. Tim Kearney, thank you so much for your expertise today. We really appreciate it. You can learn more over at CHC1.